Hello, Wake Up New Zealand, Sakey speaking. UN Agenda 2030. It was about 8 months ago when I spoke on a radio chat show, and I spoke about UN Agenda 2030, and they were almost calling me a conspiracy theorist, and yeah. So now, it's all quite different because it's really out there. And in 2019, Jacinda Ardern, she actually made her first VPN to the United Nations, a report on accelerated actions to UN Agenda 2030. And you can find that on YouTube. So UN Agenda 2030 was established in 2015, and it includes 17 sustainable development goals for the whole world. So this UN Agenda 2030, 17 out of 17 of those sustainable development goals actually include vaccinations, immunizations. And I'm alluding to what I've just recently seen in the UN website. It is 2021 to 2030 Innovation, the Decade of Action, a Strategy for Global Vaccinations. So UN vaccination plan is absolutely massive, and here's some information to wake you up some more on that one. So the information I'm going to give you, I actually got from documentation on UN websites. So I'll go down the list as to how immunisation within the SDG development goals are going to be carried out and are being carried out. So first of all, healthy children and families, immunisation increased, making it prosperity, and that's what they're calling it. Immunisation and nutrition equals healthy families, healthy lives and well-being, immunisation. Now, this is what they list as the SDG goals. So, vaccines support cognitive development through better health, improved learning, immunisation, empowering women and girls, clean water, sanitation, hygiene, wash, vaccines, less disease, healthy vaccine market, innovation, delivering vaccines along life's courses. Life courses is from the cradle to the grave, throughout life, from birth to death. So, including gender-specific interventions to vaccine services, ensuring access to vaccinations and optimal use of vaccines, responding to the decreasing awareness of the value of vaccines, where they are increasing the value universally, globally. So the strategies they're using to to succeed in these global strategy of vaccines by the UN are as follows: addressing vaccine hesitancy, ensuring global vaccine supplies meet national needs, ensure a healthy workforce through vaccinations, build and strengthen comprehensive vaccine preventable disease surveillance, supported by laboratory and base systems, secure supply chains, effective management, facilitate equitable coverage in immunisation, establish synergies with other primary healthcare supply chains, generate fit-for-purpose immunisation data so it marries up with policies, etc. for the government rewards, evidence-based decision-making, ensure functional vaccine safety systems in close collaboration with national regulation agencies into law, Build and sustain strong social, financial and political commitment for immunisation, and we've certainly got that. Ensure people, communities value, actively support and seek out immunisation services. So reach high equitable immunisation coverage at national level and in all districts right across the community, everyone, everywhere, every age. Increase coverage of vaccines amongst disadvantaged populations and reduce the number of children not reached through immunisation programs. Now that's called zero-dose children. That's a program already in place. Strengthen policies and service delivery to provide new and underused vaccines and appropriate catch-up vaccinations across life's course. Well, life's course, as I said, is from the cradle to the grave. Decrease the number and magnitude of outbreaks of epidemic-prone vaccine preventable diseases. Establish timely and appropriate vaccination services in acute emergencies and humanitarian crises. Build and sustain healthy markets across all antigens at global level. Global level. Safeguard access, quality, assured vaccines in a timely fashion in all countries in this world. Ensure sufficient financial support for immunisation programs across all countries to achieve universal coverage. That's everyone, everywhere, every age on this damn planet. Increase immunisation expenditure from domestic resources for aid-dependent countries to achieve universal coverage. For those who are struggling, don't have the money, need the aid, third world countries, our domestic policies must make sure that they actually financially support them so that there is a global coverage of vaccines worldwide, universally. Increase immunisation expenditure from domestic resources for aid-dependent countries, and that's what that is. And when transitioning away from aid, secure government domestic funding to sustain coverage of all vaccines after transition. Remember that government domestic funding is out of taxpayer pockets too. Establish and strengthen country capacity to identify, create and manage innovation vaccines. Develop new vaccines and technologies. Improve existing products, services for immunisation programs. Introduce and scale up new and underused vaccines. Improve technologies, services, practices, research. These are all strategic priority global goals that cover immunisation programs from global, national primary health care, universal health coverage on vaccines, commitment and demand, coverage and equity, life course and integration. So integrating vaccines, immunisations into life plan that is from cradle to grave. For outbreaks and emergencies, supply and sustainability, research and innovation. One size fits all, one script fits all. Everyone, everywhere, every age on this planet, leave no one behind. The Global Action Plan is leave no one behind. Decade of actions for all individuals, communities, leave no one behind. So the UN Global Action Plan, GVAP, was endorsed by 194 member states of the UN, including New Zealand, at the UN World Health Assembly in May 2012. It's a framework to action by 2020. Unusual that, 2020, we now have a global crisis. Think about that, people. Vaccines for all communities on this planet. See what's happening now. GVAP was a product of the DOV collaboration, an unprecedented effort brought together development, health, immunisation experts and stakeholders. The leadership, well, you won't be surprised at this, Bill and Melinda Gates Foundation and Gavi Alliance, UNICEF, UN, United States National Institute of Allergies and Infectious Diseases, and the World Health Organization, the UN, along with partners, governments, elected officials and non-elected officials, academia, manufacturers of global medicines, pharmaceutical companies, global agencies, development partners, civil society, media, the private sector. So you're looking at WEF, World Economic Forum, global capitalist wealthy corporations. And the plan translates and implemented, this is implemented at country and regional levels. Our regional level is the Western Pacific Regional Vaccination Action Plan. So we're in the Western Pacific region. Immunisation, UN Agenda 2030, a global strategy to leave no one behind. Strategy Plan 2010 to 2015, World Health Organization, 24th of the 3rd, 2010. Nations Millennium Declaration Report of the Secretary General UN, World Health Organization, Global Immunization Vision and Strategy. That's back in 2010. So it's about changing habits and behaviour. That's the key to overcome vaccine hesitancy and concerns and safety. Concerns about safety, and this is what they're saying: changing habits and behaviours, redesigning society, life, etc. So, intervention strategy for all instances, and that was dated the 18th of August 2015, and it's about changing behaviours and habits to accept global vaccines. So it says that these are the key to overcome vaccines: behaviour, changing behaviour and habits. So UNICEF, UN, Immunisation Roadmap, the Roadmap Strategy for Health, 2016 to 2030, articulating business of reaching the targets of the current Global Vaccine Action Plan. UN high-level meetings in 2019, failing to meet UN Agenda 2030 SDGs Global Development Goals. They were failing miserably. There were several high-powered meetings regarding this as to accelerated actions to UN Agenda 2030. So this 15-year plan looked as if it wasn't going to happen because of the failings. The UN said the progress was being made, but overall action to meet the global goals is not yet advancing at the speed or scale required for these to be achieved by 2030. So in 2019, they saw the need to usher in a decade of ambitious action to deliver the goals by 2030. Saying we must act now, we only have a narrow window to work in. So acceleration, UN Agenda 2030, and all these goals were to be accelerated through these meetings. So the strategies were fought out. And this was the year that, at the end of 2019, that's when we started having the global crisis that was about to shut the world down and bring on the global strategy of vaccines, the decade of action. So UN Agenda 2030, as I said, established in 2015, was a non-binding agreement. However, ARDERN announced and boasted her leadership to accelerate UN Agenda 2030 in New Zealand, leading the way for other nations to follow. So she's entered Sustainable Development Goals of UN Agenda 2030 into regulations, legislations nationally. Therefore, that now means, because they have been entered into those, that this is now legally binding, lawful in New Zealand. That has changed everything. So I personally believe this is this destruction of our economy, of our nation's sovereignty, a deliberate loss of traditions. When I think of traditions, I think of family tradition. And I think of the breakdown of family that's going on right now. And, you think of family and you think of Christian values and morals. All that's a part of tradition. And it's a tradition versus this modernization of this redesigned new world which is upon us. And what we have now is many people won't even talk about their Christianity. And you've got morals are becoming warped, increasingly warped, and the destruction of the family unit. It's horrific. It's dangerous. What's happening in New Zealand? And ARDERN says she's leading the way for other UN nations to follow. Well, if she's leading the way, we are going to be the first nation to fall. We are living in very dangerous times. So I've gone over all that for you. This is UN documentation to wake you up, New Zealand, as to what is really going on. So thank you. Please share, and subscribe.